So we have my good friend Kim here. Kim Johnston is a campaign director at the Ontario Health Coalition, and an organization dedicated to protecting and enhancing single-tier nonprofit public health care. Please help me welcome Kim here on stage.
Thank you, Nathan. Thanks, everyone. So I'm sort of filling in tonight for Natalie Maris. She's the Executive Director of the Ontario Health Coalition. I hope that I can do her proud and do as good of a job as she would do, but bear with me. I'm going to just touch a little bit on the Ontario experience. You've heard tonight about what privatization, will look like. You've heard about insurance companies and the fact that profit in healthcare is sort of a nasty concept. In Ontario right now, there's actually a plan. What we're seeing in the provincial government is that really there's a plan to hive services out of hospitals. Services that are protected under the Public Hospitals Act, the Canada Health Act. These services that you're entitled to, what we're seeing is that these are being hived off and actually transferred to private clinics already. Just recently, 2 new regulations came into effect, which will see even more private clinics being introduced. And what we're really worried about ultimately is that the private clinics that exist already, we're already seeing massive user fees, extra billing, upselling of medically unnecessary services. So just one example of that, we recently released a report about the private clinics. We had students in our office call every private clinic in Ontario and ask them, when I come to your clinic, do I need to bring my OHIP card? Ultimately asking, are you going to bill OHIP and bill me? That's extra billing. Are you, can I pay a little bit extra and get the procedure done? So we had, all these clinics being called and asked these questions. And in a huge percentage of the clinics that we called, there was examples of administrative fees or extra fees being charged for things that weren't necessary, or upselling. So in an ophthalmology clinic, somebody going to get a cataract is convinced that they need to get the upgraded lens. The lens that's covered by OHIP is substandard. You need to pay more and get a better lens. Well, this is just not true. And what's happening is that the private clinics that exist are upselling. They are trying to seek a profit off of people coming in, people not knowing that these things are covered by OHIP. And ultimately, people who are trusting in the healthcare system are duped into paying for things, paying administrative fees, block fees for things like a blanket, while they're at the clinic. So we're seeing a huge onset of problems like this, and what's happening is the government is actually trying to bring in private clinics bring in new clinics under the Independent Health Facilities Act, which is basically the Private Clinics Act, as opposed to the Public Hospitals Act, which actually protects patients in the same way that when you go to a hospital and you're guaranteed to get service, you're not protected, unless you're actually at the hospital. So it's a very sneaky way of actually introducing private health care. And this is what we're very concerned about, and we really want to raise awareness about and have you know that this is happening, and we do need to take a stand, and we need to say, no, we're understanding this and we're not going to allow it. Right. So just to sort of, I touched a bit on the patient experience of actually going to these clinics and being charged user fees. Really the problem here is that the private clinics are seeking profit. And this is very confusing to patients who don't know the legalities of what is covered by OHIP and what is not. And I think, a lot of us would agree that it's sort of a ridiculous expectation to put the onus on the patient to be challenging their doctor. In a lot of situations, there's optional fees, but patients feel that if they don't pay those fees, they're going to get lesser service from their doctor. So in 2012, the Auditor General released a report that showed actually that 20% of procedures done in these clinics are medically unnecessary. So a lot of times people are arguing that, we need to take the burden off the public health care system, we need to have private clinics that will allow people who can pay to skip the line, and this is actually going to save us money, it's going to save the public health care system money. This is patently false, because what's actually happening is that patients are going to these clinics, they're being charged extra fee, they're being charged, and those clinics are charging the public health care system as well. And from the Auditor General's report, we see that 20% of those procedures are not medically necessary. This is actually costing the public health care system even more money. There's also major quality and safety concerns in these clinics. I don't know if you heard about the case in Ottawa, the endoscopy clinic, where I think it was 6,000 people that were actually called to tell them, you need to go get tested for HIV and hepatitis because there was issues with the cleaning of the instruments. So we see a lot in the private clinics that there's the standards are not as high as the public system. And another thing, sort of just briefly to touch on, is that one of the common arguments is that it's a transition. We're shifting away from hospitals. We're trying to provide care where people want it in the community, in home care. But what's really problematic, and although that seems like something we want to receive care in home or in the community. What's really the problem here is that home care is not protected in the same way. And the government is also not keeping up their end of the bargain. They're not actually increasing the amount of home care funding that's available. So you might hear the government say, we've put X amount millions into the home care system. But what's happening is because of all the offloading from hospitals and because of population growth, there's actually many more people utilizing health care. And as it stands now, home care funding is actually less than it was 10 years ago per person. So what we're seeing is hospital services being cut, private clinics rising up and taking on these services, and home care, long-term care standards in those really suffering as people aren't protected in the same way that they are in public hospitals. So I just want to briefly touch on our most recent campaign. We released a report where we called the private clinics, and we also held a referendum all across Ontario asking people to take a stand. You'll see here, I'll actually pass these out afterwards, asking people to have their say and vote either in support of local public hospitals or to support cutting services from hospitals and contracting them out to private clinics. So I really encourage all of you to get involved by voting and taking some literature, and also getting that out as far and wide as you can, and really raising the alarm about what these private clinics will mean for us in Ontario. Thank you.